Today, Governor Janet Mills called on the Trump administration to walk back its new directive that she says would jeopardize housing for people in Maine. So you might remember back on Friday, we told you the U.S. Department of Housing and Urban Development will cut funding to states for continuum of care programs. Those help people at risk of being homeless get stable housing. Now, under this new HUD directive, Maine's continuum of care programs will receive about $7 million. That is a significant decrease from the roughly $20 million they're getting right now. News 8 Maine's Sam Olson joining us live tonight from the State House, where the governor spoke alongside statewide homelessness leaders about this today. So Sam, what are those leaders saying about the impact here?
Yeah, homelessness leaders here say this housing support has been a lifeline for people, and now it's just another uncertainty facing Maine's most vulnerable. Right now, more than 1,800 people utilize Maine's continuum of care programs, and now this new directive jeopardizes housing for about 2/3 of them.
With such enormous reduction as HUD has directed, our efforts will be pushed back.
Maine Continuum of Care Executive Director Dean Klein says the federal funding cuts will force 1,200 people out of their homes with nowhere to go, putting people at risk of becoming homeless immediately, as programs will have limited resources.
Changing them so drastically without an exit ramp for the many people across the state who rely on them is not just short-sighted, it is cruel.
If our elected officials do not stop these changes by HUD from going forward, the impacts will take years to reverse.
Maine DHHS's Permanent Supportive Housing Program is the largest program funded by Maine's Continuum of Care grant. It provides housing vouchers to about 1,300 people. How it works is the subsidy pays for 70% of the rent, and the tenant will pay the 30% if they have an income. This federal funding change would mean that 70% subsidy would be gone.
And they would all of a sudden be in charge of paying 100% of their rent, which is not tenable for them.
This HUD funding helps people in 106 Maine communities, but Bangor has the most people who receive the rental assistance. Jen Gunderman is the director of Bangor Public Health and Community Services.
I have also seen firsthand how housing supported by this federal funding has been a lifeline for people.
She says housing is also a vital public health tool, as she says Bangor has become the epicenter of an HIV outbreak.
HIV testing and treatment are not a priority when you need to focus on your survival.
She says she's seen firsthand how being unhoused makes it so much more difficult to make it to health appointments and even store medications. Now, as hundreds are at risk of losing their stable housing, she says it will also put people at higher risk for health crises. And those working to end homelessness also say that this directive will put added stress onto the state's network of shelters. They say there will be added strain onto other things like jails and even emergency rooms. Brian, back to you.
Sam Olson live for us at the State House tonight. Sam, thank you.